Have you ever had any pain in the shoulders, even numbness, tingling, or just restricted range of motion? If you have, you'll love this video because I'm going to talk about how the shoulder operates, how it works, and things we can do to help make it stronger by focusing on the nerve system. My name's Dr. Sandy. I've been practicing chiropractic now for over 20 years, and I love helping people naturally without the use of drugs or surgery with a specific use of chiropractic care to help them get strong again. And specifically, we're going to be talking about the shoulder in this video. Now, the shoulder we have to appreciate, and in my mind very similar to the knee as well. These are joints which there is a chance, there's a high risk actually chance of getting it injured. Why? Well, if we actually look at the shoulder, it's a very complex part of the body because what you have over here is several bones that are all working together constantly. So you have the clavicle, which is also known as the collarbone. You have the humeral head, which is the arm bone itself. You have the scapula, which is the shoulder blade. So all these systems are working together. So that's just on a bone level. On top of that, what's controlling it and helps with the healing process are the nerves that are in the back over here in the spine. So those nerves I'm talking about, like C5, C6, C7, T1, everything in that area also feeds into this area, and that's controlling motion. It's giving it power. It's giving it feedback, what you're feeling. Always remember this core concept with a nerve. It's responsible for motor function. It gives the area nourishment, but it also gets information to the body. That's when you get like maybe a numbness, tingling, even temperature. All the information, data points that you're getting into the body to the brain is going through the nerve system, but it also in this case gives it power, motion. So if this is getting compromised with the nerves, which feeds into a network, which is a bundle of nerves known as the brachial plexus, that can start to cause pain in the shoulder, restricted motion in the shoulder, numbness and tingling in the shoulder. And the biggest thing we have to remember is that the ability and the job of the nerves is to restore function. It is controlling function. That means how it's moving, how you're feeling. All these things is function based. That's why I love chiropractic so much, because it's very function driven. So we know in chiropractic, if the nerves don't have pressure or minimal pressure, the body can finally heal, restore itself, and work the way it should. So as I was saying, there might be extreme examples like a frozen shoulder. Impingement can cause numbness and tingling. Now, there's also a spectrum of shoulder injuries that can happen. So there can even be tears, because we also have to remember, I said there's the bones here, there's the nerves here, there's a lot of muscle groups here, there's tendons, there's ligaments, it's a very complex part of the body, as I was saying. So someone could have tears. Now, if they're micro tears or smaller tears, chiropractic can be effective. If it's a complete rupture or it's literally like a heavy tear in the muscle group, it may be too far gone and maybe there may be a surgical requirement. But if it's just micro tears or smaller tears, chiropractic over time can be beneficial to support that. Again, the frozen shoulder, the numbness, tingling would be more of an impingement area. But we have to remember, if those nerves are not going into those segments, that again, the motion, the feeling, it will not work right. And the biggest thing is, even if there may not be pain per se, the other thing that can happen, there can be a lack of power. So we can see things like weakness in the shoulder, not as much power. And the motions in here is incredible. So you literally have that forward motion, backwards, abduction, adduction, all these major motions, rotation. It's a very sophisticated part of the body. Now, what can cause any issues in the shoulder? So the obvious things would be things like heavy lifting. I would also say repetitive lifting. So maybe it's not heavy, but if someone has a job where they're constantly lifting all day repetitively, obviously over time that can lead to issues as well. I think a big thing I would say is sports injuries. So maybe if you fall, if you're doing heavy weights, you're lifting, that can be a big cause as well. And then I would say the other thing probably for a lot of people is your posture. If the posture is not good, if you're typing on the keyboard all day, over time that can put pressure again on the nerves, on the muscle groups. And then again, if there's pressure on those nerves, there's inflammation and tension. If someone has poor posture, that distortion can cause different muscle groups, different nerve groups to not be balanced, leading to problems as well. So chiropractic is a very effective way to address this. So what would happen on a typical visit is first physically checking the spine, for checking the spine over here, so that, as I said, the C5 to T1. But what I also meant is, again, looking at those areas, checking to see if there's any tenderness, any inflammation, and then on the patient measuring, are they able to move in certain motions? How much power do they have? Doing, some tests to see that they have that power in the shoulder. So there's tests that would be done for looking for power. Obviously, asking the patient, what are you feeling? Are you feeling any numbness or tingling? Are you feeling that there's a weakness, having that pain? A big thing too with shoulder issues I've seen is that if it gets bad enough, it can actually start to affect sleep, because some people like to sleep on their side and it can get very uncomfortable. You already have a bad shoulder, you're putting more pressure, especially on the nerve groups. It's just making things worse. And again, I keep talking about the shoulder and the brachial plexus, but that area up here, it leads into the lower, the forearm, the arms and hands. So it can actually start to affect surrounding structures. And then a lot of times what happens is if that shoulder issue is not taken care of, it can actually cause compensation on the other side, because the other side's, trying to make up for the work the other side's not doing. So what I would say to anyone listening to this is, first of all, obviously, if you're having problem with the shoulder, any pain, stiffness, numbness, tingling, any type of weakness, and it's, sometimes in life, look, we play something, we may have slept in a wrong position, within a day or two it goes away. In most cases, I think we should be fine. But if something keeps showing up and now it's been weeks, months, or God forbid, it's been like years, it needs to be professionally assessed. So chiropractically, what we would do again is test those structures, look at what's happening at the spine, look at the range of motion. Is the person able to move it properly? Are they able to handle resistance when we push on those areas? And then if we find there's a problem, if we find there's nerve compression, a misalignment, or a subluxation, we would look for those areas. And then also using a special computer we have in our clinic, we can assess that what's happening. We have something that actually is called like a surface EMG software that actually measures what's happening with the muscle tone. We also look at the nerves, and then we can see what's going on. Is there a nerve problem there? Because if the nerve problem is not addressed, that shoulder issue can just turn chronic, and you can do stretching and exercises, which you should. You can take care of yourself, but we have to look at the nerves to really help that area. So I would encourage you that if you do have a shoulder problem, or someone you care about who has a shoulder problem and they've never taken a chiropractic perspective before, I would advise you to at least consider that, at least get it assessed. And if you're having any type of trouble, like I said, a day or two shouldn't be an issue. If it's been weeks or months and even years, please get it properly checked. And one thing we do for our patients as well is that, and if you're listening to this, what I'd like to offer is maybe you just have a question and you want to know, you've tried several things, you've tried different therapies, you're like, what are my options? What do I do? How serious is this? Call our office at 905-896-3393. And let's say you just have a general question. I can talk to you on the phone. Again, that number is 905-896-3393. Step 2, which we also do, and that there's no charge, obviously, to talk on the phone as well. And the other thing I've decided to do as well, I want to make sure as many people as possible do get a spinal assessment, a checkup. We can offer you a free spinal checkup. And in that checkup, we would look at the spine. We would obviously, in this case, look at the shoulder, assess it, see what's wrong, and say, hey, we found a problem which we think we can help with. Or if we're like, you know what, this is too far gone, this is not a chiropractic case, we'll also let you know. But at least get it checked, at least see if we can help, because we've helped people with shoulder issues where they've had weakness, numbness, tingling. We were able to help those people, and I'd love to see if I could help you or someone you care about. So any questions you have, and any inquiry about a spinal checkup, give us a call, 905-896-3393. If you like the video, please like, share, and subscribe as always. I'll be making more information to help you to get more informed about natural ways to help the body. Any questions you have, general questions, chiropractic, you want to book into spinal checkup, again, which is free, give us a call, 905-896-3393. 905-896-3393. We'll always be here if you have any questions. I'll leave my information below, and God bless you.